What is Entyvio? Entyvio, vedolizumab, is used for ulcerative colitis, UC, or Crohn's disease to help improve symptoms, induce remission, and may also reduce the need for steroid medicines to control symptoms long-term. Entyvio is a selective immunosuppressant that works to control inflammation and symptoms of ulcerative colitis or Crohn's disease by preventing too many white blood cells from entering your GI tract, intestine. Entyvio works selectively in the gut to decrease inflammation and does not usually lead to system-wide immunosuppression. Entyvio intravenous infusion is used as an induction treatment for ulcerative colitis or Crohn's disease. Entyvio Pen or prefilled syringe are used for the maintenance treatment of UC or moderately severely active Crohn's disease and are given as an injection under the skin, subcutaneous injection. Entyvio infusion became an FDA-approved medicine on May 20, 2014. Its indications are moderate to severe ulcerative colitis, UC, or Crohn's disease in adults. Entyvio Pen, subcutaneous, became FDA-approved on September 27, 2023. No biosimilars of vedolizumab have been approved by the FDA. How does Entyvio work? Entyvio belongs to the drug class called integrin receptor antagonists. Entyvio's mechanism of action, MOA, or how it works, is by binding to alpha-4 beta-7 integrin on the surface of a type of white blood cell called memory T lymphocytes. Binding to alpha-4 beta-7 integrin blocks it from interacting with MAdCAM1, mucosal addressing cell adhesion molecule 1. This interaction plays a key role in causing the chronic inflammation seen in people with IBD. Entyvio side effects. Common Entyvio side effects. The most common side effects of Entyvio include fever, sore throat, flu symptoms, cold symptoms such as stuffy nose, sinus pain, sneezing, cough with mucus, shortness of breath, chest discomfort, pain in your arms or legs, tiredness, headache, joint pain, back pain, rash, itching, or nausea. Serious Entyvio side effects. Get emergency medical help if you have signs of an allergic reaction to Entyvio, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Some side effects may occur during the injection. Tell your caregiver if you feel dizzy, nauseated, lightheaded, itchy, sweaty, or have a headache, chest tightness, back pain, trouble breathing, or swelling in your face. Vedolizumab may cause a serious brain infection that can lead to disability or death. Call your doctor right away if you have problems with speech, thought, vision, or muscle movement. These symptoms may start gradually and get worse quickly. Call your doctor at once if you have fever, chills, body aches, cold or flu symptoms, mouth and throat ulcers, skin sores, pain, warmth, swelling, or oozing around your anal area. Nausea, vomiting, severe diarrhea, diarrhea that is watery or bloody, stomach cramps, weight loss, cough, pain when swallowing, or liver problems, nausea, upper stomach pain, itching, tired feeling, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Warnings. Entyvio infusion and pen can cause serious side effects on your brain or liver and may cause a serious infection. Call your doctor right away if you have a fever, tiredness, muscle aches, sore throat, shortness of breath, skin sores, painful urination, loss of appetite, upper stomach pain, dark urine, yellowing of your skin and eyes, or problems with speech, thought, vision, or muscle movement. Tell your caregivers if you have any reactions during the injection, such as dizziness, nausea, itching, headache, chest tightness, trouble breathing, or swelling in your face. Do not receive a live vaccine while using this medicine. Before taking this medicine, you should not use this medicine if you are allergic to the active ingredient vedolizumab or any of the inactive ingredients. To make sure this medicine is safe for you, tell your doctor if you have ever had an active or recent infection. Liver disease. Signs of infection such as fever, cough, or flu symptoms. If you are scheduled to receive any vaccines, tell your doctor if you have ever had tuberculosis or if anyone in your household has tuberculosis. Also, tell your doctor if you have recently traveled. Tuberculosis and some fungal infections are more common in certain parts of the world, and you may have been exposed during travel. You should be up to date with all needed vaccinations before receiving this medicine. Pregnancy. Tell your doctor if you are pregnant or plan to become pregnant. Having active ulcerative colitis or Crohn's disease symptoms during pregnancy may increase the risk of premature birth or low birth weight. The benefit of treating these conditions may outweigh any risks to the baby. If you use Entyvio infusion or pen while you are pregnant, make sure any doctor caring for your new baby knows that you use the medicine during pregnancy. Being exposed to vedolizumab in the womb could affect your baby's vaccination schedule during the first few months of life. If you are pregnant, your name may be listed on a pregnancy registry to track the effects of vedolizumab on the baby. Breastfeeding. Tell your doctor if you are breastfeeding or plan to breastfeed. Entyvio passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take this medicine. How will I receive Entyvio? Entyvio infusion is given into a vein in your arm for UC and CD. Entyvio single-dose prefilled pen is given under the skin, subcutaneously, as maintenance therapy for UC and moderate to severely active Crohn's disease. Before you start treatment with Entyvio, your doctor may perform tests to make sure you do not have tuberculosis or other infections. How is Entyvio intravenous given for UC and CD? Entyvio is given as an infusion into a vein, usually once every 2 to 8 weeks. A healthcare provider will give you this infusion. This medicine must be given slowly, and the infusion can take at least 30 minutes to complete. You will be watched closely for a short time after receiving this medicine to make sure you do not have an allergic reaction. It may take up to several weeks before your symptoms improve. Keep using the medication as directed, and tell your doctor if your symptoms do not improve after 14 weeks of treatment. How is Entyvio Pen given for UC and CD? Entyvio can be given subcutaneously, an injection under the skin, using the Entyvio Pen or single-dose prefilled syringe, for maintenance treatment of UC or CD after at least 2 intravenous infusions. See the detailed instructions for use that come with this medicine about the right way to prepare and give this medicine. Your healthcare provider will prescribe the type of device that is best for you. If your healthcare provider decides you or your caregiver can give your injections at home, you or your caregiver should be shown the right way to prepare and inject this medicine. Do not inject this medicine until you or your caregiver have been shown the right way by your healthcare provider. You may receive your first subcutaneous injection after at least 2 Entyvio infusions and in place of the next scheduled intravenous infusion. You may receive Entyvio as an injection under your skin, subcutaneous, one time every 2 weeks. Entyvio can be injected in your upper legs, thighs, or stomach area, abdomen. The upper arms may also be used if a caregiver gives the injection. You should use a different injection site each time you use the medicine. Do not give an injection into moles, scars, bruises, or skin that is tender, hard, red, or damaged. Always check the label of your prefilled syringe or prefilled pen to make sure you have the correct medicine before each injection. Do not shake this medicine. Entyvio dosing information. Usual adult for Entyvio infusion dose for Crohn's disease or ulcerative colitis. 300 mg for over 30 minutes at weeks 0, 2, and 6 and then every 8 weeks thereafter. Usual adult SC Entyvio dose for Crohn's disease or ulcerative colitis. Following the first 2 Entyvio intravenous doses administered at week 0 and week 2, the dose may be switched to subcutaneous injection at week 6. Week 6 and thereafter, administer 108 mg subcutaneously once every 2 weeks. Discontinue therapy in patients who show no evidence of therapeutic benefit by week 14. Comments. Before initiating therapy, patients should be brought up to date with all immunizations according to current immunization guidelines. What happens if I miss a dose? If you are not able to have your injection or infusion at your regular scheduled time, or you miss a dose of Entyvio, inject the dose as soon as possible. Then, inject your next dose every 2 weeks thereafter. If you are not sure when you should have your next injection or infusion, call your healthcare provider. What happens if I overdose? If you take more Entyvio than you were told to take, call your healthcare provider. What should I avoid while receiving Entyvio? Do not receive a live vaccine while using Entyvio, and avoid coming into contact with anyone who has recently received a live vaccine. There is a chance that the virus could be passed on to you. Live vaccines include measles, mumps, rubella, MMR, rotavirus, typhoid, yellow fever, varicella, chickenpox, zoster, shingles, and nasal flu, influenza, vaccine. You may receive killed virus vaccines such as a flu shot, polio vaccine, rabies vaccine, or hepatitis A vaccine. Ask your doctor before receiving any vaccine while you are being treated with Entyvio. Avoid being near people who are sick or have infections. Tell your doctor at once if you develop signs of infection. What other drugs will affect Entyvio? Tell your doctor about all your other medicines, especially vedolizumab. Medicines to treat psoriasis or rheumatoid arthritis, such as etanercept or golimumab. Other medicines to treat Crohn's disease or ulcerative colitis, such as adalimumab, certolizumab, infliximab, or other drugs that weaken the immune system such as cancer medicine, steroids, and medicines to prevent organ transplant rejection. This list is not complete. Other drugs may interact with vedolizumab, including prescription and over-the-counter medicines, vitamins, and herbal products. Not all possible drug interactions are listed here.